Not everything is rainbows and unicorns on a ranch. Sometimes animals get unexpectedly injured and you have to deal with the repercussions. Today, we share how we care after animals and ensure they are healthy. Welcome to Hashknife Hangouts. I'm Calen. Brandon is my co-host, father, and partner in crime. As always, please like, comment, and subscribe. You can also find us at the social media handles below. For those returning, thank you for your support as always. And now to animal care. This is actually run number 2 for us because I forgot to hit the record button. So here we are. So to say what I said before, there are people who, well, actually, first of all, this has segued from the previous episode and the episode before that. And again, just like my previous joke, it's almost like I planned it that way, because we talked about animal care and how a lot of those who may oppose the way we do things, the way we operate, and just frankly our way of life, they often will cite how we don't care about the animals. We treat them inhumanely, and that's just simply not the case. What we do, in fact, do every time an animal is hurt is we take care of them. We provide essentially their own veterinary care. If it exceeds our abilities, we will specifically call the vet and ask him or her to come assist us or help us or do something, and we will be there to assist them. But what we will do is today we'll go over cuts, how some of those animals get the cuts. A lot of times this is coming from experience with horses, frankly. Abscesses or infections, a lot of the times this comes with the cattle. You'll find some that we call lump jaws, and there's a reason for that. We'll explain that in a little bit. Swelling, sometimes you do see some swelling in some legs or the foot area, and maybe just concerned swelling in other locations on the animal's body. We'll go over some of our holistic approaches within the Hashknife Ranch. Some of the things we have found works well for us. It may not always work well for other people, but some of the things that we've used and we found to be successful for us. The internal injuries, again, we have shared some of these things. There was a young steer last year that died of water belly. That is an internal injury, and you can find that video and maybe check out what exactly we're talking about there. But then finally, the one thing that people never want to talk about, which is euthanizing an animal. What are the ways we go about doing it? Why do we do it? And what's the best way to do it so that we take care of the animal and that they don't have to suffer? So with that, I will hand it over to Dad, and we will continue with this conversation for the second round.
I think we got about this far and you realized we were recording. So
Yeah.
it was early. That's good. We didn't waste a lot of time. And this way you can always see we don't script things. I mean, it just, we throw it out there.
The truth.
We don't doctor a lot. I mean, that's just something that's when you have to, you do, but it isn't like we're spending every day or every week doctoring something. I mean, it's not that common, to where we're super practiced at it, but in a way we are, because you just take the lessons from what you've done before and talking to vets and watching them when they do something. I mean, it's all kind of common sense, and it's the same procedure for us as it is for an animal. Clean the wound up, keep it clean, and let it heal. Let it be able to drain. If it can heal on its own as much as possible, that's perfect. So one of the things you mentioned was lump jaw. That's basically just a big lump literally on the jaw, and that can be caused from any number of things. One is splinters on a cow. They're constantly rubbing themselves, it seems, especially in the spring, getting rid of hair, that winter coat. Lice, if you got too many lice, that if in the winter, they can itch and bite, and they're trying to relieve themselves from that, and they can pick up a splinter on a wood post. And like the lump jaw, we got one cow that has that and has had a kind of a recurring thing, and it's not anything attached to the bone. It's not on the jaw. It's just in the skin below the jaw. And I have lanced it, and it's broken open on its own, drained, and at some point it will heal up. But we just kind of monitor her, keep an eye on her, and we've had others where you can lance them, and a ton of pus comes out of them. I mean, it's amazing how much the body will try to isolate a source of an injury and then try to get rid of it that way. And so you'll lance it, clean it, lance, drain it, clean it again, and let it drain. And sometimes you'll get the offending whatever it is out doing that and don't realize it because it's in a bunch of pus. And then other times like this one, it's something that's a little bit more chronic. She's always in good shape. You can tell she's not in any pain at all. Raises a good calf, but it's just something that it's just chronic. So you monitor that, and if it gets worse, then you might do something about it. Well, you would do something about it, but other times it's a one and done. You can lance something, particularly on those, and if it's not attached to the bone, then it's just something they've picked up. It could be a tumor, cancerous, something happened with an abscess on a tooth, which is disrupting, the molars and the jaw itself, and you'll feel that a hard lump that comes out. And when that happens and they can't eat, then they either got to go to town as a slaughter animal, or and usually in cattle, that's what you'll do. If it's a horse, which rarely happens on a horse, if there's an injury bad enough that a vet can't fix, we're kind of getting ahead of ourselves, and euthanasia is an option. But yeah, we try not to feed antibiotics into our animals, and let them heal naturally, and use a few things. Like one of the things for wound care we've used, and I think we showed on a video of the horse here, last year before, got
Yeah,
an
I think it
injury,
was
came down on a post.
last year.
Yeah,
It would have
year and
been
a half ago.
it would have been December 2020. So we'll put a link up above for that one.
Okay. Yeah. And, it was actually in a good place, if there's a good place for an injury, because it would drain on its own. But, we brought it in, noticed it, brought it in, cleaned it up. And then I believe we did give him some antibiotic on that, because
Yeah.
it was a deep enough wound that you want to make sure that you don't have any anaerobic type infection going on there and cause gangrene, and, bad things happen then. But, clean them up, same wound care as you have on humans. Keep it clean, get it out, keep it clean till and allow it to drain till it heals, and monitor them the whole time. Um, you mentioned the water belly on the steer. Uh, that's kind of an injury, but it's more a medical issue there, where it's basically a bladder or a stone, so it occludes the urethra, and causes a backup of the whole plumbing system, and he was draining pretty good. We kept him on water. He was able to drink a lot, hopefully flush those out. But change of feed sometimes on a steer will do that. And I think partially with a steer, it's because they've been castrated, and so they don't have the growth, testosterone, and the growth on the whole length of the penis, smaller, and stones can get occluded if they develop from a change of feed. Typically, you get a little bit more calcium buildup in a change of feed, particularly going to alfalfa. And tried to transition him, but he was one of those that, could be genetics that cause that. So you deal with that the best you can. Those are tough ones because they're not always fixable. They are, but then it's the business decision of, I can have a vet do surgery on this animal, and they can put basically like a stent in it up above the high in the urethra, so they dribble, but they aren't going to really gain weight like they should. They're really not going to produce for you, so they're going to continue to cost you money. The surgery alone can be as much as what the animal's worth. So we try to hopefully keep them comfortable, get them to pass stones, and fix that issue, and then go on and raise them later on without putting any antibiotics into him. And I did have to on him because he was you could see he wasn't feeling good, sick, so did that, and ultimately he did die. And he was looking actually pretty good. It was kind of surprised me to find him dead, but he did die. So I mean, I hate to have that happen, but it can. Hindsight's always 2020. I should have just euthanized him right away, but you can't tell, what's going to happen.
Yeah.
I could have sent him to the ring, sold him at public auction, and made him somebody else's problem. But that's not the right thing to do either.
Yeah. Well, that's also the part too of this is, we care for the horses and the cattle, but sometimes it just doesn't work out. And that's what we'll kind of talk about at the very end. But to start off, we'll talk about just cuts. You know,
Mhm.
everybody gets cut at some point or another, and like Dad said, a lot of times it's very similar to human care. The one the one difference is you can't really talk to them and tell them what's going on. They completely understand. Most of the time, they kind of got it figured out, but it doesn't mean that it makes it any easier because they'll kind of fight you and they don't want to stand still and they want to because you're hurting them. You know, in the process of trying to clean it up. You know, when mom grabs the alcohol wipe and starts wiping your boo boo down, it kind of hurts. You know, and trying to get them to understand that you hurting them is actually you trying to take care of them. They're just not a big fan of that. But a lot of the times, there's three things that I thought of specifically, and Dad kind of talked about them uh, throughout. The only thing he didn't say was proud flesh, but draining, debris, the cut. And then I wanted to talk to you about, you know, what is proud flesh? What does that mean for us when we're caring for them? But then again, to kind of tie that into a bow, all of that stuff, taking care of the animal just like you would a human. The only difference is you can't keep them out of the dirt, and that's one of the biggest challenges.
Yeah, and it's particularly the horses get proud flesh, and it's a just over acceleration of growth, cell growth, and particularly if it's not kept nice and dry and allowed to heal. One of the which is kind of a paradox in how to care for it, and that is, I mean, we'll literally get a garden hose, well water, cool, and you just keep applying water to it. You're just irrigating the area. Well, we do that on our own wounds. You just clean them up with they're just a little bit bigger volume, and spray that out till it's all soft and the scab around it comes off. You debree that, and then uh, keep it keep it so it's dry or dry as you can, and then we a lot of times we'll put a powder on it that's it's just clay. It's called French green clay, and probably just the marketing of it. But um, that stuff's amazing. I went to attended a clinic. Some folks had on and were really gracious enough to have us there, and a lot of wound care from different ailments on animals using um, essential oils, some of the other types of powders. Particularly the clay. The clay also has kind of an anti vector where flies won't bother the wound, which is a huge, huge plus in the summertime or,
Right.
when flies are out. It and helps it heal. It's amazing how that stuff will really work really, really well. And so that's kind of one of our go-tos. We'll spray it down with something like Vetricin, which is a um, topical to help promote wound closure or healing. Spray it down with that, and then apply the green clay, which will attach to it, and kind of makes kind of a paste in a way as you do it. Not that you're mixing a paste, but it kind of creates it that way and covers that wound. And that has been an amazing thing. And I think we've used that for probably the last 6-8 years, probably,
Yeah.
um, and makes a giant difference. I mean, we used to back in when I was a kid put scarlet oil on stuff, particularly horses, and you always were fighting proud flesh, and it kind of works, kind of doesn't, and depends on the cleanliness and how to keep it that way and how much you do it. But there's a lot of times we're cleaning these horses or cleaning an animal. Particularly, it seems we have more horses that we have to doctor than cows because horses they try to get cut. I mean, they try to find wire, they try to find whatever
Yeah.
they can, and so we have more opportunities, I guess, with the horses, but um, used it on cows too. And your mother, it's like she's like we were joking yesterday with Braden about something. She's like the movie where the guy had the Windex for pimples.
Yeah.
The
Big fat
Greek
Greek
wedding.
wedding.
Yeah, there you go. She and I always get that. Can never remember that. And she's kind of like that with the French clay.
Yeah.
It's that green clay, and you know what? It works. And she's always grabbing that stuff and some Vetricin and irrigate it out, and it works. It works very, very well. So that wound care for cuts is big. You can take some very wide cuts, something you think, oh my God, that's never going to heal, and without a huge scar, especially on horses scar easily, and you just irrigate and apply that and put the clay on it, and debriding is important so that it doesn't build up that the scar tissue underneath of a scab. It's got to be clean enough and irrigated enough that that comes off, and I've seen some really, really long, big cuts, and you can't even tell when they're healed up. It's amazing how well that works. So, um, if you had to suture something, you could, but we seldom suture anything.
No. Well, and that kind of leads to the last point I had on cuts is, we don't typically cover it. We leave it open so it can drain out, because if you
Drain.
don't let that that the grossness that is, the pus or anything else that might be, creating itself to try and heal, if you don't let that drain, it causes further problems. So oftentimes we'll leave a cut open, and what we will do is we'll put the clay on, and that's part of the holistic approach that we'll talk about. But the clay helps in a lot of different regards, and so it'll clump up and it'll help kind of clot the blood as well when you're after you've cared for it and irrigated it. But then it's not it's not so it's not so good at stopping clots that it doesn't allow the drainage too. The drainage is still able to get through that clay, and you'll see a lot of the times it just looks gross. The next day you go look at it, and that's when we're like, okay, it's gross. Grab the horse, halter it, let's irrigate it again. And when you start seeing that it's less and less gross each time, then we start kind of just letting it scab over and heal on its own, and occasionally intervening, maybe every couple of days rather than every single day. And that seems to be, for us, what works well with cuts. But I think having drainage and not covering it is really another big key factor to that.
There's spots on an animal that you can't put a band-aid on it. You can't
Right.
put a patch on it. So you just have to do the best you can, particularly, anything other than a limb, right? And there is risk when you cover a limb as well, because that's a lower leg on a horse that's a pretty delicate, type of structure. A lot of tendons, veins, artery, ligaments in there, and you can over tighten and cause problems with the movement of that horse. So, you cover it when you can, and it's not necessarily to stop any bleeding or something like that, but it's more of just trying to keep it clean.
Right.
But the lower it is and closer to the ground, the higher probability you're going to get it dirty or muddy, or if we have mud in this country. But um uh using good common sense, and the first time you put clay on something and it's draining and it looks bad, you're going to irrigate it, you're going to wash it all off, and it's amazing how, yeah, it looks bad, you irrigate it, and wow, there's already an improvement within a day or two. So you just keep doing that, and then when that you know change um slows on the healing process, then yeah, you're right. You go maybe a couple days, watch it close. Oh, I don't think we're going to do anything with it today. Let's let it keep going. And then you're going to do it eventually. You might, that night or something, do it, start skipping um, sessions of some of your wound care. But eventually you're going to have to not do a thing to it. And it's next thing you know, you've forgotten about it and they've forgotten about it.
Well, and that goes to the next part too, abscesses and infections that you talked about. And I think it's important because it's very much the same thing in terms of, we're talking about drainage with cuts, drainage with abscesses. Once you've lanced it, like you've talked about, allowing that infected area or whatever it is to drain out of that as much as possible. I've seen videos where people have, if you look on YouTube or Twitter or something like that, I'm sure you can find plenty of videos, even TikTok, plenty of videos where people are cutting a lump jaw cow, and then they cut it on the top, and that to me makes no sense. It
Yeah.
doesn't allow the drainage. What they end up doing is they cut the lump or the abscess or some sort of infection on the top, and then they push it out. Not only is that disgusting because you're getting all of that grossness all over you potentially because you're pushing it out, but you're not allowing gravity to work when you're not there. So like being able to lance it and cut it and make a slit on the bottom of that abscess and let gravity and everything just push it out of the animal, in my opinion, is the best way to go. I know, I'm not a doctor, but to me that passes the common sense muster, but I don't know.
Well, yeah. And a good example of that is sometimes you would, or we would, and I have done this a lot for other people, and that's castrate calves.
Mhm.
And there's a way to do that where there's a couple of different styles of how to do it. And one is you take the scrotum and you split it. and then you pull the testicles out and, neuter them that way, clean it up, wash it up. But when you split it, then it will grow together as a vertical wound. And so what I always like to do is take and cut the bottom of the scrotum off, just kind of makes a little round circle, but it's on the bottom and it drains, and both testicles will come out. You just do the same thing. You trim them up, pull them out, trim them up, and wash it out, but it's always draining. And it's amazing what will happen, especially as the warm weather comes on, you have flies. A lot of times those that have been split in the scrotum will develop maggots because the flies are laying, because it's not draining quickly enough. It's trying to
Right.
heal. And then the bottom, seldom do you have that issue, and it's allowed to drain on both sides of that scrotal sac. So
Well, and
that's an injury that you're giving.
you bring up another point though too, is allowing the drainage also helps to kind of, in a sense, flush the area as well,
Yes.
using the animal's bodily fluids to remove any dirt that might get kicked on it or
Right.
anything else. Like you're talking about maggots, so allowing the blood and the platelets that they're creating to help push the the fly eggs out of their wound. Like in a sense, it's using their body to the most advantageous position possible to help them heal.
Well, yeah, and it's generally a lot smaller wound too,
Right.
right? I mean, so that there's that helpfulness there, but you can't, if you can't get a wound to completely heal, and it heals from the bottom up, and then all of a sudden you're trapping some of that rejected type of immune response out of the body, and then you complicate that with a fly laying eggs on there, and you get maggots. Then you got a bigger systemic type infection, and you can cause death. I mean, animal can die by having that happen. So when you induce an injury like that, then you gotta do that, I think, in a way that's as least harmful or least long-term potential for harm that you possibly can. I mean, I've had some vets that when you give I even do this now, I give a shot. If I have to give a shot to something, and I put it in an IM or intramuscular, I will try to give that like on a hind quarter below the slope of the hind end, where if it's going to drain, it's going to drain out the bottom, and if it gets an infection. I'm not putting it on the top of the hip or on the top of the rump where it can't drain. And I had a
Right.
vet tell me that years ago. I was like, this makes such sense. I've not had it happen, but still the potential's there. And maybe it doesn't happen because it can drain a little bit. I don't
Right.
know. But she was adamant about, no, you don't do this. You put this on the bottom here. I mean, and I was asking her, why do you put it there? I was always asking her questions about, Vicky, why are you putting that? Why is your shot placed there? And she'd give me that. She was a hard girl. I loved her, but she'd give me an answer, and it was very good, very factual, and was like made a lot of sense to me. So
Yeah.
you learn a lot from your vets when you employ them to help you. You assist them. I'm not telling them what to do. I've called them for their expertise, and they are subject matter experts,
Right.
in a lot of fields. So I always ask them, why are you doing this? What are you doing this for? What will you do here? I mean, I'm trying to get, I guess I'm trying to get my money's worth out of them while they're there, asking them, whatever. And they're always they're so good about answering your questions and trying to help you do the right thing.
Now,
Never had a vet not do that,
yeah.
ever.
When you lance an abscess or an infection, I've seen it done various ways. I'd like to get your input. Is it one long cut on the bottom? Is it an X? Is it just like a sizable hole? What's the best way to go about lancing an abscess? Particularly, I keep going back to like a lump jaw on a cow because that tends to be the
Yeah.
most prevalent. But what is the best way to go about lancing that so that it can drain and you can get the infection out of their face?
Well, you got to think of it as being like a ball underneath the skin, right? You know that there's a
Right.
capsule of pus that's there. And so it can vary in size. But I'm going to try to find the lowest point of that if I can. In fact, first of all, I'm going to try to find out if there's a spot where it's leaking out, and trying to ooze out and trying to reject itself on its own. It's probably the point of insertion, wherever whatever's there went in. try to find that and then just cut off of that or build off of that to the lower point. And making X's, I mean, you're making a couple of different cuts then. So whenever you make a cut in a hide, I mean, now's your potential for infection to get in.
Right.
So I try to just do one. It's like when I was a kid, they used the whole thing about if you ever got bit by a snake, which was a real thing. I mean, you teach your kids what to do if you get bit by a snake. And back in when I was a little kid, you made an X from the point of insertion of the fangs, an X to from one side to the other. Well, hell, you can hit veins and stuff, and depending on where it's at in an arm, you could do some real damage to some tendons. So it was all of a sudden learned like, oh yeah, no, you cut with, that straight, and don't try to cross those, because you're inducing a flap, actually 4 flaps of skin then, which will open up just fine. But if I use a single one, but it's long enough that I'm able to get everything out. Let's say if a lump is the size of say a golf ball underneath a chunk of hide, I'll try to cut uh, along the bottom of it where it starts to curve up on either end of that. So on a golf ball, you're probably putting in a 1.5 or 2 inch deep or wide long uh, cut or incision, but it's a little misleading. And that's why we have people, young ones do this. You got to learn, and you're going to learn that getting through a piece of cowhide, even
It's
on
a little thick.
even on a jaw, it's thick, and you have got to enter that capsule where it's at, and that means pushing in and having a nice sharp scalpel to do that. Clean that area good with some good iodine-based wash or betadine, surgical scrub. Clean that whole area up really, really well so that you're not pushing in a bunch of dirt or something, and then making that incision, and then really working the whole area to push it out. And it's sometimes it gets on you, and sometimes it's stinky, sometimes nasty. It's what it is. You just got to deal with that. And then I like to take a syringe. We got some of those like 60 cc syringes, and fill those up, because all it is for just creating a good wash, and then pushing that up inside of that wound where it's big enough to accept that syringe up inside of there, and start washing it, and wash it, really, really well, and hopefully flush whatever's in out of that, and then put some clay on there, let her heal. It's amazing
Now,
how well they will heal with just one application, except for this one cow we got. That's a chronic one, and for whatever reason, but she'll break it open, it'll drain, it'll heal, and then it'll break open, or fill up, break open, and heal. And she's doing that on her own. As long as it's doing it and it's not causing her any other issue, I'll let it do it and monitor it.
now, when it comes to swelling, the the swelling can really be any location. It can be various reasons for swelling. When is it a concern and when is it not? Because you might see swelling on like a shoulder, like a bump or something, about a fist. Oftentimes you'll see it on a horse, like their shoulder. It'll be like a fist size bump, and they probably just knocked themselves into something, or they got kicked by another horse. Or you might see some serious swelling on maybe a leg of a horse or a cow. When does it become a concern for you, and when is it just kind of something you're like, they probably just got kicked or bumped?
Yeah, I mean, it's all about observation, right? And watching and monitoring it. If I see it, I'm gonna, you're cued in on that. You're always looking these animals over every time you're around them. You're looking at them and watching them and checking them, and looking for stuff like that. Anything that's not normal. And if you noticed a bump on there and they're limping on it, chances are they probably got kicked. And so, which horses do? I mean, they're all little playground bosses, and they all want to win. And so, they got their hierarchy. If that lump or size continues to grow, get larger, and they don't move as well, their motility is not as good. Mobility, I should say, not motility, but uh, if they don't, if they are, it's getting worse, then I'm going to start watching it. And if it looks we got something that needs to be lanced, particularly on a horse, I might, on a shoulder like that, I might have to consult a vet, see what's going on. They may have a broken shoulder, which a lot of times they'll hold a leg up. I've only seen a broken shoulder on a horse, I think, once, and that was just a year or so ago, on a horse that some people wanted me to train. I went to look at it, and that morning, and this had happened. I was like, holy cow! and it turned out to be a fractured scapula.
Mm,
So, but you really couldn't see much difference in it, except that it was starting to swell within a couple hours, but he just wasn't putting any weight on that foot or on that leg at all. So it depends on what's going on there. Some things you can only see through an X-ray,
right.
honestly, and we don't have an X-ray machine laying around. That's where your vet comes in, and particularly with horses. So a cattle, I still watch them. You might have a foot issue. Swelling is something typically you'll see in limbs, lower
Right.
limbs, and they might have stuck themselves in a hole, twisted it, and just watch it, monitor it. As long as it's not an open wound, there's not a lot you're going to do to it, right? Except monitor it and it watch to see if they get better or worse. And if they get better, giddy up, you're good to go. But you're always looking to pick stuff up in a pasture. I mean, we've had this country settled now for about 150 years, 140 years really. And so homesteaders, old people, they just kind of dropped what they were doing when they were at, and you'll find old pieces of iron or old homesteads that are not much left over from, and you'll find things, and cows will pick stuff up and eat it. Believe it or not, little chunks of barbed wire. Um, they're always chewing on something, it seems like. So, you may see that they've swallowed something and you got a little what we call hardware disease. And if they get that down the stomach, then you can, it'll can perforate the stomach wall. The best thing you can hope is that you can put a magnet down in their gut and it'll hold it to the bottom and kind of keep it out of the way so they can still eat. I mean, that happens. Vets do that. There's magnets that are placed in stomachs. So um, just monitoring that stuff and picking stuff up so they can't do it. Try to make it. If you can make it horse proof, you can just about make it cow proof.
I was gonna say,
But
it's like making it child proof, just for
it kind of
four-legged
is.
children.
Yeah, and you're never going to get it all. And you may have something fall off the back of a pickup that you didn't realize, and you forget about it. That can happen. But I'm always looking to pick stuff up. That drives me crazy when I see that out in a pasture somewhere. I can even be horseback, and I'll get off and pick something up if I can pack it, or get it to a fence line and hang it on a post where I can pick it up.
Now we're talking about swelling, but I'm going a little out of order how I originally had it, but that's okay. The swelling can often be a indicator of other injuries, like you just kind of pointed out. The two we talked about water belly, which I think you made a good point of bringing forth, which is it's not really an injury versus it's just a medical issue or concern. I can't think of any off the top of my head right now, but sometimes there's other medical conditions. I guess there is one that we had sarcoids on a horse one time, had to have them surgically removed, not once but twice, and then it finally didn't come back. In a weird way, it's if to explain that to people, it's like a bloody wart on the leg of a horse, and we had to just simply have them removed, and then we essentially treated those as cuts, like we talked about earlier, drained them. We actually had that particular one, we had to put some stuff on it, keep it covered, and it was also in the middle of winter, so there was a whole bunch of other stuff with that. But there's medical concerns and stuff that happen, but swelling often is an indicator of internal injuries, like possibly broken bones or dislocations. What kind of other internal injuries are there, or would you like to just maybe talk about and explain a little bit more about dislocated things and broken bones?
Well, that rarely happens in cattle and horses. I mean, it just being left to themselves, unless they got a leg caught in something,
Yeah.
that can happen. But generally, it's not too much. One thing you worry about with horses is colic. That's a pretty
Good
common
point.
thing. That's a medical issue that it can be a change of feed, um, particularly, or too much of a feed of one kind, and they founder. Another one that kind of goes hand in hand with it. But um, colic is a big deal. It's potentially life threatening. They can just be rolling around and get a gut twisted, and now they can't process or uh, grass or waste won't go through the intestinal tract because it's now got like a loop in it, a role in it, and they can die from that. Or, if you get surgery, just because you have surgery on them doesn't mean you're going to save them either. So horses
Well,
they're tough, but they're delicate
I
in
just
another sense.
I just thought of another one too. There was a few years ago where we had a cow that calved really hard, and we ran up to the ranch and we were milking her to try and get all the blood out of her system because she had a really hard birth with that calf, and we were concerned about it was mastitis,
Mess.
wasn't it?
Yeah, well, and that was just the calf. She was overproduced milk. She's had tons of milk, and the calf really wasn't doing that well, and really hadn't figured out how to get the milk and how to nurse well. She did on like one nipple, and but the others were so large she really couldn't get it on her mouth. So milking her out, saving some of that the good milk, but then you could see it was starting to get a little curdy looking, which is a and then blood in it, which is a concern for mastitis. But we got that turned around really quickly and was able to keep her milked out. What amazes me is cows that in the fall when and of course I think milk production is a little bit lower when those calves are a little bigger because they're drinking less and eating more grass. They're starting to transition, but that milk production isn't huge like it is at first birth with colostrum needs for the calf. But it's amazing to me that when those cows dry up, they don't get mastitis, but they generally don't. And you'll see it in dairy cattle too, I guess. Um, when a cow comes fresh, they're always looking for that as well because that can ruin an entire. You don't want to put infected milk or bad milk in with your good batch. So
Yeah.
and that's their product is milk. So they're always looking for things like that. And I'm sure there's different ailments on that, and probably just the very fact that they're milking them all the time, cause some soreness. Who knows? But a cow sometimes it hurts when they got a big bag, and they'll kick that calf off. They won't let them nurse, which is really the cure for getting that milk out of there and reducing the pressure. So they'll cause that on their own. But yeah, that can happen. Again, when you got a cow with a bag like that, that's not a perfect scenario for something you want to keep there. She'd be a really good potential for culling and send it to town, becoming hamburger.
Now that is one holistic approach to fixing issues. But the main ones we use are I've got them here: Epsom salt and the French green clay, which we've actually discussed quite a bit of. Um, the other thing too is I know some people will use compresses and dressings. I don't really recall us ever doing that. Again, the only time I've ever seen us really dress a wound was with Mr. Zarkoid when we had to bring him in every day and do
Yeah.
that in the winter. But that was kind of an extenuating circumstance. Have you had other injuries where you've had to kind of dress or put compresses on them in
Yeah.
addition to some of the other stuff like green clay, Epsom salt, or something like that?
We had a sale horse one time. There's been a couple issues like that. Epsom salts is really for a lower limb, a foot, for the most part. You really can't dip a cow or a horse into a vat
Yeah.
of that stuff and hold them there. So it's usually an application. It's basically it's a liquid poultice, right? Where you're going to draw something out. And the same way with a uh, like a flaxseed poultice, you can, that's been done. And we did that. I think you were pretty little one time. We had a horse that had had something in it, like we suspected a cactus spine or something, and got into a leg, and couldn't figure out what was going on. Called a vet, and we did a poultice like that where it was an application, and you did hold that on with a bandage, being really careful how you bandage and being specific about how you bandage, uh, where you put the pressure at and how you put it on. But anyway, drew that out. But Epsom salt, a liquid poultice, um, it's fantastic. We had this horse that we had for sale, loaned him to a guy so he could try him for a week, and said if you take him somewhere, we want shoes on him. We'll put shoes on him, or you can put the shoes on him, but do not run this horse barefoot, in hard country. Well, guess what he did? Ran him hard and stone bruised him, and so that horse come back and he was limping, and so we started with Epsom salt, and your mom did that like 4 times a day, 5 times a day. You guys were pretty small. Remember, you might have helped her and get that water kind of as hot as you could stand, and put in a bunch of Epsom salt and make that horse stand there. And the first couple of applications were a little tough because they're like, well, I don't want to stand there with this 5-gallon bucket around my leg. And finally, it got to where he's like, okay. And we just stand there and he just gave up. And I think she had that thing erupted probably in about 3 days. And once it erupted, boom, the pressure was off and he was able to heal up and was plumb good. But that's a kind of a poultice because you're drawing that out, but that's a liquid
Right.
type. And then just like a patch or a big mass in a bandage. Flaxseed can be a really good one. There's kind of a holistic way to do that as well. So yeah, we try those home remedies. There's a reason why they used them, because they work without having a lot of expensive, things that are maybe sometimes caustic to skin. They might help what's going on, but you might have some, you know, things that are not completely good for the healing process.
Well, and I would say between Epsom salt and irrigating a wound and then putting the French clay on there,
Yeah.
that covers about 95% of all of our issues. Sometimes we
You
have
know,
a couple others, but most of the time it's just those two specific remedies, and
yeah.
everybody is hunky dory within, probably a couple of weeks.
Yeah. And if you could only pick one for wound care, if you could only do one single thing, irrigation
Yeah, that's what I was gonna say.
is the
Grab the
biggest thing.
hose and just spray
Keep
it
it
down.
clean,
Yeah,
spray it down, keep it, so you're not getting proud flesh started. You're not closing the wound too soon. Horses heal fast, and so they can close a wound pretty fast and then encapsulate some infection. So that, and when I say irrigate with a hose, I mean 10-15 minutes.
yeah,
And kind of the guide I use is all of the scab around the outside of the wound gone. And if it doesn't come off with a hose, can I just touch it a little bit and rub it and it comes off? And if you can do that and get it all clean, now you're done.
right.
And sometimes it'll take 20 minutes. But it is, I think, probably the most powerful um, cleansing thing that you can do uh, if you had nothing else to do. And I mean, you do that with everything as a precursor, but certainly if you had nothing else, that will go a long ways.
Well, and I would say a final indicator for us also is when we have debrided the wound and irrigated it with water. A lot of the times when it's just starting to have some fresh blood come over,
Yeah.
and you've got that nice pink muscle or skin or
Yeah.
whatever that's underneath, and it's just starting to we're not trying to make them bleed, but like the body is reacting and starting to kind of get the growth going there by promoting more blood flow. That's when we know to stop, and that's when we'll put the clay on, and then we'll leave it. But that, yeah, I agree. If you had to do anything, it would be irrigation, and that would work with, I would say, abscesses too. All you'd have to do in that case is cut it, drain it, and then try and irrigate it, and then leave
Yeah.
it as it is.
Yep. Yeah. No, and because when you put it, anytime you put like iodine, which or betadine is kind of an iodine based type of uh, disinfectant, you're still hitting some healthy cells with that.
Right.
Where the hose and water irrigation is getting to the point where you're starting to see a little bit of blood start to flow or start to ooze towards the top. You've debrided that proud flesh down is tough, and that is kind of a weird looking, you know, pinkish whitish growth on a wound. That's what proud flesh is, and it grows very, very fast. So keeping that down, it also causes scarring. You'll see scarring on particularly you see it on legs. That's where most horses get wounds at, is on their legs, and they heal fast. And this is an over accelerated growth of those cells.
The final point is the uncomfortable one that people don't want to often talk about, and that's euthanizing an animal. In blunt terms, like people, if they don't know that's a $5 word. It's where you put the horse down or the cow down because something has happened and you cannot save them, or it's just going to it's going to be so financially irresponsible for you to be able to save that animal, that it's a business decision to simply end it
Well,
right then and there.
and are you prolonging the suffering of the animal
Right. And
by
that, yeah,
not
that's
doing it? And
another
that's,
good point. Yeah.
I mean, you have to look at that as what's the ultimate outcome? Is this animal suffering? Is it ever going to not suffer? And those decisions are hard. I hate those. I mean, they're gut wrenching because you do care about these animals.
Mhm.
And so when you make that decision, then that's only part of it. That's the no action decision making part of it. Say, okay, we have to do this. Then it's executing that. I mean, poor use of words, but you really are. You're putting that into action, and you're taking that animal's life to stop the suffering, and along with that, that's my primary thing. I mean, if I can fix an animal and it's less than the cost of what the animal is, why not try that? As long as it doesn't prolong suffering and they come out of it, then that's why you call the vet. That's why you have them do what they do, because the animal has value above what it's a business decision of this is going to cost more, and it is, and you hate to put it in those terms, but that's the reality of it.
Well, and for example, let's go to like the horse racing world for a second. A lot of the times they have a lot of broken bones in their legs. There's multiple reasons for this, and I think we've discussed this before, and we'll probably discuss it again. But um, some of those horses are millions of dollars worth, or at
Right.
least not even just the animal, but for example, the studs, the semen that comes from them are worth millions of dollars. And so to save that animal, it's a good business decision to do whatever you can to do it. However, sometimes I would argue it is at the cost of the animal itself, and that should
Right.
not be the case whatsoever. You should say, you know what, as much as we could make millions of dollars off the semen for the rest of this animal's life, it's just not worth it to the animal, and we need to euthanize because that's the
Correct.
responsible thing to do to take care of this animal. But
Right.
that's oftentimes not the case.
Yeah, no, that's a good point to that, and it's a good way to show that. Um, how do you do it? You can have a vet do it,
Right. Which,
and
if
which
anybody asks, normally that's just a syringe and a needle with whatever mixture I'm sure they
yeah,
have.
they just put them to sleep and then give them something that will, um, you know, you generally like polarize the heart. We were j-
Mhm.
we were just talking about this with Braden yesterday. He's an EMT and he gives IVs and things like that. And we are talking about lethal injection for um, people on death
Inmates.
row.
Yeah.
Yeah, and he's like, "Hey, you know how they do that?" And he was telling me, and I was like, "Yeah, I actually did that with some animals when I was a game warden." Um, a little bit of potassium chloride goes a long ways, but unless those animals are asleep and unaware, um, under anesthesia, basically, then it's a pain. It would be a painful death. So, I mean, there's a responsible way to do that too. But, generally the vet will give them a shot, put them down, put them to sleep, and then give them something that's a lethal uh, dose of a drug to go ahead and end their life. That's not always possible to do that. You're prolonging the suffering sometimes, and we'll do it ourselves, and not through drugs, but a gunshot wound uh, placed right to the brain, and I've seen them actually suffer less that way than with drug use. It's certainly shorter, done right, and that's one of those things you make damn sure you do it right. Um, you don't want to do it wrong, and it's dramatic. It's not fun to watch, and at that point, you'll have nervous reaction, but they're gone. They are dead when you have to dispatch an animal like that, and they fold up completely, just are standing there and they just fold themselves up. You've hit that nervous system in the right spot where they're gone. After that, it's just some muscle twitches from uh, the nervous system shutting down.
Yeah. And I would say we always try to do everything in the most calm way possible as
Right.
well. It's like you're talking about the fact that taking them, having a doctor come out or taking them to the doctor and doing that, it actually causes further stress. So the
Mhm.
fact that we are able to sometimes and oftentimes just do it in the field, we're not putting them through chutes, we're not putting them in corrals, we're not causing any sort of stress whatsoever. We simply take care of the problem then and there, and then the animal is gone forever, and they don't have to continue with the suffering. And sometimes the fact that they may be hurt bad enough that they can't move anyway, it's just
Right.
best to do that, because then you don't again prolong the suffering, provide extra stressors or anything like that. But
Well,
um
and you know, and you try to do it as in as kind and gentle way as possible. And particularly if we have an older horse that they're not gaining weight,
yeah.
there comes a time when it's time to put them down, and we will do that with letting them chewing on some grain. It's almost like their last meal.
Hmm.
They're enjoying some oats and eating, and then they don't even see it come. Same way with cattle. You can do the same thing. Let them eat something, and then let them. They're enjoying that, and then they give you an opportunity to put them down where you're not gonna screw it up.
Yeah. Okay, that is taking care of animals, injuries, care, medical issues, and then some of the ways we go about actually taking care of them, in terms of the things we use, the more holistic approaches. And then finally, sometimes it just doesn't end well, and you got to take care of it the old school way, and that is euthanizing the animal. Euthanasia. Wow, I can't say that word. Euthanasia. There we go.
There you go.
Which honestly, I think as a policy, I had a great grandmother who had this conversation. She said, sometimes we treat animals better than we treat humans, and I wish we could have euthanasia for humans as well. So that's my partake on that. As long as it's consensual from that individual, it says, it's just my time. I need to go, and they're at that upward ripe old age that they're like, man, everything hurts. It's just not worth it. I want to do it. I guarantee she would have taken that route.
You know,
But
and
that's my
with that
parting
said,
thought.
yeah, you can. And there has been a number of older animals that it's almost like they're asking you to
Hmm.
help them.
Yeah.
I mean, you can just see it in their eyes. You can see it in their face and the way their demeanor is. They are wanting some help, and that help is relief. And I don't want to be here anymore. It's odd. It's just a something that you can't really explain until you've experienced it. And when that happens, there's no question. It's time, and I am thankful and happy for them that I can do that for them. With that said, I don't know what there is more to cover on that. So
Yeah, that's all I got. I'll wrap it up because Dad is is failing his mission. He let me finish this
yeah.
one out. So
Oh, you
I'm gonna.
think?
Yep, I got it. So hey, thank you for joining us. Thank you for uh coming with us on this journey. Thanks for always supporting. And until we can better pay you, we thank you until you're better paid.